This video will cover Rosai-Dorfman disease. The official name for this disease is sinus histiocytosis with massive lymphadenopathy. Let's anchor ourselves. To remember Rosai-Dorfman, notice how this scene is set in a location that's heavily decorated with roses. And roses sounds like Rosai, right? To anchor ourselves to the fact that this is a disease of histiocyte proliferation of unclear etiology, notice where the scene takes place. It appears to be a pretty historic location, but there isn't one defining structure or object that tells us exactly where this location is. So these two things will help us remember histiocyte proliferation of unclear etiology. The atypical histiocytes characteristically have round nuclei with prominent nucleoli. Our symbol for prominent nucleoli are large prominent eyes, just like our character here. Another characteristic finding is emperipolesis. This is essentially when cells engulf each other without affecting each other's functions. This is different from phagocytosis. To represent emperipolesis, we have this ghost here who's about ready to enter the young man's body, just like how these cells enter into each other. And by the way, this disease tends to affect younger individuals, which is why I chose this character. It also tends to be indolent, which might explain why this character seems pretty unfazed by what's going on. Now let's move on to characteristic IHC stains. S100 is expected to be positive. And just like in other videos, a squishmallow with the number 100 on it is our symbol for S100, since squishmallow starts with an S. Also from prior videos, we can remember that CD163 is represented by a bag of candy with exactly 163 pieces, just like this one. CD163 is expected to be positive. CD68 is also expected to be positive. The symbol for this one will be this gate here that is made of sticks. The word gate sounds like the number 8 and the word sticks sounds like the number 6. Put these together and we get CD68.